Now to our big exclusive. Yesterday, the Union Cabinet approved health coverage for citizens aged 70 years and above, irrespective of their income status under the Ayushman Bharat PM Jan Arogya Yojana. This move aims to approximately benefit 6 crore senior citizens from 4.5 crore families with a 5 lakh free health insurance cover on a family basis. Now, the eligible senior citizens under the scheme would receive a new distinct card that entitles them to the benefits of the scheme. Additionally, senior citizens aged 70 and above who are already covered under the Ayushman Bharat PM Jan Arogya Yojana will get an additional top-up cover of rupees 5 lakh per year. Meanwhile, those senior citizens who were already covered under other public health insurance schemes such as CGHS, ECHS or Ayushman CFF can opt to either continue with their existing schemes or switch to Ayushman Bharat PM Jan Arogya Yojana. So how exactly did we end up with this very significant decision and what is the reasoning behind it? I'm being privileged right now to be joined by Indu Bhushan, the founding and former CEO of the NHA and also Ayushman Bharat. Mr. Bhushan, thank you so much for joining us on Mirror Now. It is indeed a pleasure to have you. And first of all, congratulations, as your brainchild has come up with a massive decision which has gotten a lot of plaudits from across the country today. My first question, how and why did this monumental decision come about? The call to remove income level restrictions on Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana.
The original vision of the scheme was that no one should be denied the treatment only because they can't afford it. So the government started with the most vulnerable, and they defined vulnerable as the people who were poor, living on the margin. But if you look at the whole scenario, poor people are of course vulnerable, but there are other people also who are equally vulnerable, and elderly being one of them. Elderly usually don't have their own source of income. They are dependent on others. And also towards the end of their life, they need large healthcare, medical care. So adding them, because they represent both vulnerable from economic perspective because they don't have control over their income, but also because they need a lot of medical care, was a natural step towards universal health coverage. Ultimately, the entire population has to be covered. And when I say entire population has to be covered, they don't have to have access to free healthcare, but they should be able to get quality healthcare that they need, and they should be able to pay according to their ability. So, seeking ability to seek healthcare, quality healthcare according to the need, and paying according to the ability is essence of universal health coverage. And what government has done yesterday is a big leap towards universal health coverage.
That's right, absolutely, Mr. Bhushan, because this is also a very this is an excellent case study of how a proactive government responds to feedback, given that statistics show that 24% of beneficiaries of the Ayushman Bharat so far have been senior citizens.
Absolutely, and government has. I'm so pleased that government has taken this decision, and this is going to help a large number of people. And as you know, that our population is aging now, and we are growing. The number of people who are above 60 or 70 are increasing exponentially, and so there is a need for providing them a social safety net and providing them coverage for health is a beginning. I think it's a great decision, and like you said, that across the party lines, this has been welcomed, and I look forward to a very strong and very effective implementation of this decision in weeks to come.
Mr. Bhushan, I'm sure you're a man of data and numbers. What is the ballpark figure that we are looking at when it comes to the number of extra beneficiaries of this expanded plan?
Currently, within Ayushman Bharat, The numbers that we have, the people who are already covered, because, among the 65 crore people who are covered already, 1.2 crores are above 70. So they're already covered. So but in addition to 1.2, there are about a couple of 2 crores more who will be covered under this. So slightly more than 3 crores, according to my information and calculation. But I think this numbers should come from the government. This is based on the data that I have.
Okay. Yeah.
The more than 3 crore people. It's not the number which is important here. I think it's these are the 3 crore people who are one of the most vulnerable, and so covering them is a big step.
Mr. Bhushan, I think you have been a bit conservative with the numbers. Our estimates tell us that 6 crore beneficiaries are going to be there and 4.4 crore families will benefit. But let me ask you another question about numbers, a question which comes often with a move such as this. Who will foot the bill? Because we are looking at an initial cost of 3,437 crores for the expansion of the scheme.
Yeah. So, of course, in the health sector, for supporting people who can't pay for themselves, the money has to come from the government and the taxes. And this is the legitimate responsibility of government to provide resources so that people who can't afford healthcare have access to it. So it has to come from the government, and of course, government is willing to pay for this. And as we go towards truly universal health coverage, probably more money will be needed. And as you might know that, in terms of spending on healthcare, India spends one of the lowest in the world. Our investment in healthcare, public investment in healthcare is about 1.5% of GDP. And there is government commitment to go to 2.5% of GDP. And 2.5% of GDP means almost doubling our investment in healthcare. So we are looking for expansion of healthcare, including through a scheme like this.
So, Mr. Bhushan, could you give us some insights on the Prime Minister's vision behind both this Yojana and his expansion? This is something obviously very close to the Prime Minister's heart. As founding CEO of Ayushman Bharat, you must have had a ringside view to the Prime Minister's ideas.
I was, of course, founding CEO of Ayushman Bharat, and at that time I had several rounds of discussion with the Honorable Prime Minister. And as you mentioned rightly, that this scheme was a brainchild, or prime motivator of the scheme was Mr. Modi. This was when we started, it was actually called Modi Care. And he was very closely involved in the design of the scheme. And even at that time, it was very clear that we need to expand it to more than 40%. But the idea was that let's start with 40% of the population, which is the most vulnerable, most disadvantaged population. And as scheme takes roots and and we get more and more comfortable with the scheme as implementation capacity increases, then at that time we will expand it to other groups. And so some other groups were added recently: ASHA workers, Anganwadi workers, and now elderly. And so there are other groups also which need to be added, and hopefully in the next round they'll also be added. My own view is that there should be certain diseases which are so difficult to treat and also expensive to treat, and which also put people into poverty. For example, cancers. They should be included for everyone, irrespective of their income status. Therefore, I think this is a great step, a very welcome step. But there'll be some other groups also which will need to be covered in future.
Mr. Bhushan, since you talked about the next step, are we also looking at perhaps expanding this program in terms of lowering the age ceiling, perhaps to senior citizens above the age of 65, maybe even 60?
Well, I can't comment on that. It will depend on many factors. But for sure, the scheme
Okay.
has been evolving for last 6 years. The scheme was launched on 23rd September 2018 from
Hmm.
Jharkhand, Ranchi. And so we'll be completing 6 years in about 10 days' time. And in these 6 years, many changes have been made, many groups have been added. And I'm sure as we proceed further, as the scheme takes even further routes, then we'll see more groups being added. One group which we've been talking about is missing middle. There are certain set of groups or population which are
Okay.
not poor enough to be eligible for Ayushman Bharat, but they're not rich enough to buy private insurance. And these missing middle get into the fall between two stools, not too rich, at the same time not too poor. So for them also, there has to be some
Okay.
scheme at some point in time where probably they can make some contribution, and based on that contribution, they can be provided healthcare support. But again, it has a lot of complications, and the government will consider it in future. But I think for the time being, uh, we should celebrate this decision, and let's hope. And I'm quite not hope, but I know government is
Okay.
going to be implementing it effectively and quickly.
All right, Mr. Bhushan, thank you so much for joining us on Mirror Now. Always a pleasure to have you.